Good morning, and thank you for joining us for our first live in a long time City of Lubbock COVID-19 news conference. Today, we have some new panelists with us today. We have our usual Director of Public Health, Catherine Wells, Local Health Authority, Dr. Ronald Cook. We have the Chief Medical Officer of University Medical Center, Dr. Mike Reagan, Dr. Craig Ryan, the Regional Chief Medical Officer of Covenant Health, Robert Taylor, the Co-Chair of the Lubbock Economic Recovery Task Force, and Mayor Dan Pope. So let's start with Catherine Wells.
Good morning, everybody. It's great to see you all in person. It's been a long time. I'm going to give kind of our usual update on our case counts and then also talk kind of what we're seeing through the contact investigations that the health department is continuously performing. We are currently at 14,675 cases here in Lubbock. We're seeing that case count increase significantly every day. Over the last few days, we've seen at least 200 cases per day, and yesterday we hit our all-time high at about 310 or 311 cases being reported out. This is way too many cases for a community our size. We've also seen an increase in the number of deaths. Unfortunately, we are now seeing COVID spread in our nursing home facilities, and that has contributed to multiple deaths in this community. We also have now 2,005 active cases of COVID here in Lubbock. Through our contact tracing, we are really seeing spread when individuals are letting their guard down. We are not seeing spread in workplaces or schools where everybody's wearing masks and we're practicing social distancing. The places that we're seeing spread are at birthday parties, dinner parties, large celebrations such as weddings, clubs and dance halls, crowded restaurants, caretakers not wearing their masks. We're seeing spread when individuals are not following the advice of their physician, and even though they should be under quarantine, are still going out and spreading disease to others or virus to others. And it's just that hanging out. It's people gathering together outside of school or work and just hanging out in the living room, watching football games together. That's where we're seeing our spread. And I know it's hard, but we need to be wearing masks in those situations and really limiting the number of people we're interacting with. With that, I'm going to pass it over to Dr. Cook.
Thank you, Catherine. Pardon me. Always start out with the same thing. Wear your masks, socially distance, wash your hands, and get your flu shot. That's so important, and we have so much evidence that those physical barriers help stop this virus. And that's been proven over and over and over. Today's whole press conference is our concern about the number of COVID patients that we have in the hospital and the number of patients that we're seeing just show up with positive. We have a number of healthcare individuals. Before, when this all started in March, we had lots of surge plans that had people lined up, first string, second string, third string, to take care of the people as they came in and got sick. Now, many of our healthcare workers just in themselves are getting ill, and that concerns us because our numbers, our capacity to take care of you, as you'll hear from our hospital leaders, is decreased. I do have some good news. For our neighbors down south in the southern hemisphere, flu itself has been relatively mild. And that's because, now COVID is in the southern hemispheres as well, but because they're social distancing and wearing facial coverings and washing their hands, flu is relatively non-existent in the southern hemisphere, and they're finishing winter when we're about to start winter and we're driving us indoors, which is another risk factor. That greatly concerns us. Here's the bad news. Flu in itself kills lots of people every year, right? In the last 5 years, we've had about 178,000 people in the United States die from flu. This year, in 9 months, we've had over 216,000 people die from COVID. That's well over the last 5 years total combined of flu, and yet people still think this is just the flu. It's not the flu. This kills people at a much greater rate than the flu ever has. And I think this year our flu numbers will be lower from evidence of what we see in South America or the Southern Hemisphere. I know that individuals don't want to be cooped up anymore, and we have COVID fatigue, and we want to go to parties, and we want to have birthday parties, and we want to be in the park when it's warm. Those things can happen, but we must continue to wear our facial covering, maintain our social distance from each other, and wash our hands and get our flu shots. We know that those physical barriers work. There was also something in the news that I heard this morning. Oh, well, maybe we should just relax and let herd immunity take over. That is fatal news. More people will die from COVID if we do that. It's going to take some people say between 65 and 80% of people to have antibodies against this virus for herd immunity to take place. That's not going to happen until we might get a COVID vaccine, and even then, and we're months away from COVID vaccine. Months away for everybody to get vaccinated for the COVID virus. If we give up and just let natural herd immunity take over, many, many, many more people will die. Let's don't give up. We can do this. We can continue to engage with each other, but the new norm is stay out of my 6-foot bubble and make sure you have a mask on and make sure that I have a mask on. That's how we can do this. Wash our hands and get our flu shots. Let me hand this over to Dr. Craig Ryan. He's the CMO of Covenant Medical Center.
I want to echo some of the things that were just presented by Dr. Cook. When I was much, much younger, I took my young sons from daycare and took them to the park one afternoon, and at 5 o'clock I looked at my watch and said, "Boys, we got to go home. Mommy's going to be home. She's going to wonder where we are." My 3-year-old put his hands on his hips and said, "Daddy, let's don't go home yet. Mommy's sick and tired." And I tell that story because we are sick and tired. Everybody in this community is sick and tired of COVID-19. We're tired of dealing with it. But Ron is right. Now is not the time for us to give up and stop doing the things that we've been doing. Not only are we sick and tired of this pandemic figuratively, our caregivers are becoming literally sick and tired. Our nurses have worked long, unbelievable hours. They are exhausted. We've got caregivers that have acquired the virus, either usually, honestly, at home or in social settings. They're not really acquiring it that much at work, and we've done the contact tracing to verify that. Our hospitals have done incredible jobs with infection prevention. To me, that's one of the safest places on the planet to be because of the infection prevention things that we have going on. But there are finite resources. There are total numbers of beds that we can staff. And it's not just about the bed capacity that we have, either at University Medical Center or at Covenant Medical Center. It's about the number of doctors and nurses that continue to be available on a daily basis to take care of the patients in those beds. If we continue this upward trend, we're going to run out not only of beds, we're going to run out of caregivers to take care of the people that are affected by this pandemic. So the message to the public is, I know you're sick and tired. I know that's the case. Everybody's tired of this. We want to just make it go away. But right now is not the time to stop doing the things we have been asking you to do to stop the spread of this deadly disease. So please, please do what Dr. Cook and Catherine are telling you. Keep your guard up, wear your masks, socially distance, be socially responsible. Thank you.
Craig, thanks for those comments. I think we're seeing the same picture. And, you know, the purpose for coming today really is to be heralds of what's going on in the community in terms of infectious disease. And there are 5 different things that happened that peaked out this week. The number of cases, we had a record number, as Catherine said. In our hospital, we had a record number of COVID admissions. We also had a record number of COVID patients in the ICU. We hit a record number of employees that were out because of COVID. Dr. Ryan said that we're having providers, physicians, advanced practice professionals come down with the virus. That's true across the medical community. And so we're very challenged in terms of the volumes of patients. And we're worried about how that goes. Every day, we send a patient home, we put a patient right back in that bed behind them, just constantly turning over those rooms because we're maxed out. I think both hospitals are maxed out on patient volume. And so we need your help. One thing we know from the hospital is if you wear your mask, if you wash your hands, if you practice safe distancing, you can reduce the spread of COVID. And that's what we're asking you to do, is to wear your mask, wash your hands, and practice safe social distancing. It will make a difference for us, and it will allow us to continue to care for all of the patients across our city and region. But we are hitting very high levels of patients, and so it's very important that you help us.
Okay, thank you, Doctor. Robert Taylor, I want to approach this from a business standpoint. I think we're in a very dangerous place. As far as health, I've personally been to too many funerals already that involve COVID. But from a business standpoint, we are in a very dangerous place. And it's been mentioned before, and I think the main contributor to this is the COVID fatigue. People are tired of wearing masks. They want to return to normal. They want to see family. They want friends over. They just want it to be normal again. But you know, we're not in that situation, and we got to play the game by the rules about the what we're given. I'd say right now, if you compare it to a football game, we're probably near the 4th quarter, and we're tired. We're fatigued. We don't know if we can go any longer, but we're at the most important, the most critical part of the game, and we've got to. There's so many things that are in play here that are so dear to our hearts and things that we want to do. Got the opportunity to see Coach Beard yesterday, and we got basketball coming up. We'd love to fill up the United Supermarkets Arena and see it go to another Final Four, and to see Coach Garlick and what she's going to be doing with the girls team. We got one of the finest places getting ready to open December, or part of December, in Buddy Holly Hall. 22,000 seats together, people together. Will attract some great entertainment, some of the best in the country that we'll have an opportunity to see. We got to keep our schools open. We got children out there now that they have to go to school. When they don't, they fall behind. We don't need a whole generation or years worth of education to go to the wayside. We can't afford that in our educational system. And you know, from a business standpoint, the really big prize is to protect and expand all the positive things that are going on with our economy in Lubbock, Texas. Last 3 months, believe it or not, sales tax collections are up over last year. There's not, I beg to say there's probably not another city, state of Texas that could say that. It's very unusual, but we've got a strong economy, but we're in such a fragile place right now. We've got very low unemployment. Most of our people can find jobs. Another risk is in retail, we got people that are working. In service sector, we got people that are working. And now we're seeing quarantines, and we're a lot of services and a lot of retail are at a breaking point to be able to staff and meet the needs of the community. So there's a lot of things riding on this. You know, the sad thing is we know what to do. We've seen it work. We've seen it work in our own business. when we're really good at what we know what to do, we make a difference. And I don't care whether somebody thinks it's only 10% effective or 90% effective. If it's effective at all, we need to be practicing what we know to do so we can save our jobs, save our economy. Like you've heard, we're at that point. There is one thing that everybody knows that is a tool, and it's worked in the past, and that's lockdowns. We don't need our economy to go through another lockdown. We need to learn to live with this disease, curb this disease, and do all we can. We need to look to one another and depend on each other to wear their masks, to distance, to avoid crowds. And if we do that, we can coexist with this and buy time until we have a chance to get some vaccines out there, some treatments to lessen the impact. But that's the most important thing we as citizens, and it takes everybody. If we've got 90% of the people doing it, 10% not, that spread is going to continue through that 10% of the people. So I just want everybody to look at what they want to do, where they want to be next year at this time. And to get there, we've got to go through this fourth quarter. We've got to make this work. It's not fun, but I plead you to step up the line and make a commitment to do the things we need to do and keep Lubbock going. With that, I'll turn it over to Mayor Bowe.
Thank you, Robert. I want to start by thanking Ms. Wells, Dr. Cook, Dr. Ryan, Dr. Reagan, and Mr. Taylor. They have led our community in the response to this pandemic since March, and we all rely on them, and I just want you to know how thankful we are for what you do for us. I'm going to show some data slides real quick and then have a few brief comments. So this is our 14-day rolling average positivity rate. It's too high. Our hospitals just talked about the impact that COVID-19 is having on them. You can see it displayed here. I think it's important to note that for much of the summer, we were on the receiving end of transfers, patients that came from other parts of the state and New Mexico and Colorado to our hospitals. We now find ourselves not able to always take care of the region that we support. If there's a glimmer of hope, it's how well we've done with K-12. I'll talk about that in a minute, but we still have relatively few active cases. The recovery of our 17-year-old, our school-age kids, is still very, very good. Same when you look at recovery, many, many more cases, but this is your cases from 18 to 25. Very few active cases. They recover quickly, and we're thankful for that. And finally, maybe the most telling of these slides, that leads us, I think, to understand what's happened in our hospitals. Although the largest number of new cases still falls between the ages of 18 and 29, you see a significant spread into the community, into that age groups from 30 to 70. The demographics have changed about who's in our hospitals. It's a much younger patient on average in our hospital today than what we've experienced through the last 6 months. I want to start by just offering words of sympathy and on behalf of the city to the families that have been impacted by this virus, by the businesses and the men and women that work in those businesses. I think it's important that we recognize that. I'm pretty plain spoken. I'm the guy who sort of famously said earlier this, or infamously said, wear your damn mask earlier this year. I'm going to tell you right now, we're in a bad spot. If something were to happen to my wife, if she were in a car wreck, or if one of your mothers or fathers needed emergent care, or if one of our kids needed emergent care, we in Lubbock expect to have that at our fingertips. We rely on world-class health care, and we have that. That's at risk right now. If you show up at the ED, you're likely going to wait in a long line. It's controllable. I'm going to tell you a story that's happened in the last week in our community. You know, we love to celebrate those big birthdays. And when you're my age, you know, that might be, your friends might be turning the big 5-0 or the big 6-0, and those are important times. And we had a situation happen in our community where at least 9 people went to one of those important birthday parties, and they all came out infected. Think about the impact that has on 9 families and on maybe 9 churches or 9 workplaces. That's how this spreads. There's not a pass given to just hanging out. We've got to wear a mask. We've got to keep our distance. We've got to wash our hands. And we've got to hang out only with those people that we have been hanging out with since March. We are continuing to test. We have abundant testing in our community. We're thankful for that. We're tracing as diligently today as we did on our very first case. We have not let our guard down. We will not do that. But we need people to isolate when you test positive or you've been exposed. You do that for yourself. You do it for your family members. You do it for your neighbors. Please, please, wear your mask. Let's be kind, and let's be safe, and let's be hopeful. Thank you.
Okay, we're going to open it now for media questions. For those of you here, if y'all come up to one of these mics and state your name and what organization you're with, and if you are joining us via Zoom, please raise your hand and we will put you through. You can ask a question and one follow-up if needed.
I guess I will start. All right, I'm Sarah Self-Walbrook with Texas Tech Public Media. As Lubbock's COVID situation continues to worsen, we don't seem to be changing how we're responding after loosening up some restrictions in recent months. What will it take to change that?
Well, we know what works. I'll give you an example, Sarah. Our K-12 schools have had virtually no spread. In fact, we have situations where we had teachers that tested positive and had been in the classroom, but no kids tested positive in their classroom because everyone was following protocol. It works. I don't think we're going to go backwards. We've got to be more disciplined. We've got to do what we know keeps us safe.
Anyone else want to chime in? Okay, as my follow-up, I understand that a lot of your hands are tied in a lot of cases after the governor took back quite a bit of control earlier this process, I guess. So what are we asking the governor to do to help us here in Lubbock right now?
I think they've been, the state's been very responsive. They offered this week, they offered our health systems help with nursing help if we chose to take advantage of it. We know that Amarillo has taken advantage of that, and we get good returns from that. We continue to ask them for testing capability, and they respond. I find the state to be, I find them to be very responsive. I think we've got their ear. I would let anybody else that you guys, Dr. Ryan's been very active in the RAC for many years. Dr. Ryan, you want to add anything to that?
Yeah, I probably need to explain that the way the governor is looking at the state of Texas, we years ago carved the state up into what we call regional advisory councils or trauma service areas. They're called TSAs, trauma service areas. And he's looking at the percentage of hospitalizations in all of the trauma service areas. And once that percentage of hospitalized patients reaches 15% of all hospitalized patients being COVID positive, the governor will probably shut things down in terms of numbers of cases, elective cases that we can do, restaurants, bars, gyms. He will shut things back down. And that's what Mr. Taylor is talking about. We don't want the economy shut down again. But that is absolutely dependent on us keeping our caseload below that 15%, and we're dangerously close. We're at what, Michael, about 13.3 this morning? As a TSA, we're at about 13.3 hospitalization percentage of COVID-19, so we're dangerously close to being on the shutdown list in the governor's office. So by doing the things that the mayor is asking us to do, by taking the steps that we know are effective, we can stay off that list, and we can ride that balance beam between having the economy shut down again and being absolutely overwhelmed with more COVID cases than we can deal with.
Sorry, one very quick follow-up. El Paso did roll back some of their capacity earlier today. I believe restaurants, for example, back to 50%. So if we hit that 15% hospital capacity, is that when we could start to see that here?
I don't know the answer to that. That's a bit of a hypothetical. I'd prefer to deal with that if we have to deal with it. I certainly hope we don't have to.
Thank you.
Mr. Mayor, I would add one thing to that, and the clarification is this. The governor has said if you reach 15% of your hospitalized patients being COVID positive for 7 days in a row, and it requires that 7 days in a row, that's when he will pull the trigger. We're not there yet. We don't want to be there.
Okay, we have a question via Zoom from Christy Martinez from Latino Lubbock.
Good morning, gentlemen and ladies, and there you all are. We keep hearing about these cases that are happening in personal or intimate gatherings, but do you really expect for the public to believe that they are the only ones causing this when there's all these public events that are being held and you're seeing pure evidence of people not wearing masks, and even though the organizers are taking the precautions, at these large gatherings, these folks are not all being responsible. What's your say on that?
I think I've already said it. We've got to follow every safety precaution. We have great safety plans for events that happen in the city. I think we've had very good compliance. One of our challenges is that events that happen indoor don't have to come for any approval. The only consideration there is occupancy, percent occupancy. We've not seen significant spread, very little actually, on events that are happening outdoors. Most of our problems come from small events, generally what you might describe as parties or house parties or people just hanging out.
Let me ask my next question. This one's directed to Catherine. Catherine, I know that you have worked very closely with LISD, and the mayor reported that there's very few to no cases, but I have information otherwise. I have received many calls from parents. I've received many calls from teachers. And from what I understand, we're seeing some high numbers today. So how can we say that there's no issues when even our school system, and we're not, we're preparing for flu season, and we know that, I know that they're taking a lot of precautions, but I just don't feel that if there wasn't some type of concern, we wouldn't have parents and educators calling us. So, I mean, what numbers are you getting, and why do there seem to be some indiscrepancies?
Yeah, I think we need to look at, there's what's happening in the classrooms, and my children are in in-person school, and teachers wearing masks, students are wearing masks. We're able to control that environment. When those kids walk off that campus, we're seeing gatherings, we're seeing parents being exposed, which is then causing children to be in quarantine. We're not seeing transmission between two children sitting next to each other in the classroom. We're seeing it through all of the other extracurricular activities, those gatherings, the play dates. That's what our contact tracing shows. And when we're in these environments where there isn't that control, and there aren't necessarily set rules, that's when we see it. And we really need people to focus on those events that they're choosing to do in their lives, and really reduce that or make sure that we're wearing masks.
But aren't teachers being exposed by the students that do come back to the classroom infected?
We're testing teachers, we're testing students. We're not seeing the transmission. They're getting it from other places.
I'd like to just add one more thing. One of my friends, Dr. Fitz, is on a ventilator today. I just talked to him on Friday, and he said, pray for me. And I said I would. And I told him, when we get done, let's do a live interview. And today he's on a ventilator. So it is a serious issue, and I hope that the public will respond. And thank you, Mayor and Catherine, Dr. Cook, and the others for your continued efforts.
Thank you, Christy.
Hello, Matt Dotre with the AJ. Dr. Cook, I do want to ask you a hypothetical. So let's say this trend does continue. Let's say Lubbock continues to get 200 to 300 cases a day. I mean, how bad do you see this being in a few months? What do you see happening in hospitals in a few months?
Well, I agree with Mayor Pope. It's hard to work through scenarios that are hypothetical. We have to a little bit. If we don't stop it, then we're going to be in real trouble. If we don't slow this down, we're going to be in real trouble. And what does that look like? It's hard to see maybe what that's going to look like, other than if you get sick, if I get sick, I may not have a bed that I might need, that your family might need, that your loved one might need. There's potential for this surge, especially as we move into the winter and move indoors, get closer to each other. It could be disastrous. Here's the other thing. Everyone that's listening, everyone in this city can slow this virus. You just have to choose to do so. And you choose to do so by social distancing, wearing your face mask, and hand washing. That's how we never expect this to go away to zero completely. What we have to do is slow it down where those who need hospitalization and those who need ventilators have access to those items when they're needed. But that's up to everybody in this community. Everybody must. If you decide to go to a party, keep your distance. Wear your mask. Stay away from people. I know that's hard. I'm just as social as anybody. But I choose not to do things because I don't want to get sick.
I know we're seeing the most spread at private gatherings, but Ms. Wells, you did mention that, sorry, appreciate that. Ms. Wells, you did mention that you are seeing community spread in restaurants. Have you seen more since they increased capacity to 75%? And I guess how prevalent is it at, restaurants?
And it's crowded restaurants. It's places that people, sorry. It's crowded restaurants. It's places where people are not being compliant or following masking. When you go into a restaurant, you should wear a mask. You should go sit at your table. When you're eating, remove that mask. If you get up to use the restroom or go get a drink at the bar, you should be wearing a mask, and the waitstaff should be wearing a mask. And that's what we expect to see. And if you interact that way within a restaurant, it's safe.
And there has been some discussion about healthcare workers getting COVID-19. I mean, help me understand how serious that is. I guess I'm asking the hospital leaders. I mean, are you having a hard time filling staffing? And is there anything being done to kind of make sure healthcare workers aren't getting it outside of work? I know that'd be tricky.
Well, so I would say, answer your second point first, and that is our contract tracing, just like Catherine was saying, is very much the same. We're finding not much spread at work, but outside of work where the spread occurs. So that tells us a couple things. One is that the precautions do work. So I fully believe wearing a mask, doing the right thing, social distancing, washing hands, makes a difference. In terms of the staffing, it is a worry. People will go out on quarantine. Fortunately, over a period of time, they can come back in after that's completed. But we are having to redeploy staff to cover positions. Yesterday, we had a phone call about our provider workforce, the physicians. We've had some key folks go out, and so we've had to redeploy there as well. And so that is a worry. You have the actual beds, but if you start to struggle with staff, that can be a problem. And so if the message is not clear from everybody here, this is a serious deal. We need to do something now. Each of us can do something now to help this. So I think it is a very important question.
Thank you.
We have a question via Zoom from Olga Aguero with El Editor.
Buenos dias. Hello, everybody. Good to see everybody. It seems that every 2 weeks now that we're having these press conferences, we hear the same message. We're given the same information, but with worse numbers. I'm just concerned that why can't we just be honest within ourselves and really pinpoint sometimes the problem that really exists? Well, we have a national leader saying that this epidemic is nothing, that this epidemic can be just disappear. When you have a national leader saying that, it's going to affect us, y'all, here in the local level. And if we were just to pinpoint and say, do not listen, those persons are lying. Persons are misleading us. Those persons are the ones that are making these numbers grow. We have to stick together, like Peter says, and the mayor. We have to stick together because we're all in this together. And we have to consider that if those numbers do not come down, if there is but no choice but to shut down, well then, can we be honest and say those people that were going around saying that this was fake, this was nothing, those are the ones that are putting us to have a shutdown. Why can't we say that instead of every week? And it's a beautiful message. I know what it takes. I have lost some real good friends. I have lost some family members with this COVID. But I just wish that we could all be on the same page. And I would want our mayor to be one of the first ones. You're our leader, Mayor. And having these big events, these rallies, are not good. I'm sorry, but with all due respect, I understand how you look at things. But we got to be honest here in our local level. With that being said, are we gonna be asking for help in the medical field if we get to that point? Are we gonna have a hospital, a portable hospital to be built here if we get to that point? What is the plan? We're asking, but yet we don't know. Or I can't say hypothetical things. We gotta get serious. And that's, if that takes my 2 questions, that's fine, but I would like to hear a response by our mayor.
So I think I'm going to let the hospitals talk about their surge plans in just a moment. I think that would get to your question. I think most of what the first part of that was more comment. I don't know about the big rallies you're talking about in the city. I'm not aware of any big rallies. There are some large events that are happening in the county and have continued to happen, and as much as we would like to have control of that, we don't. We are continuing to be very diligent about responding to events over 10 people, outdoor events over 10 people. You self-certify from 10 to 49. Above 49, you go through our process with Alert and Lubbock Safe. We've continued to update our guidelines on the website. In fact, they're updated to be in sync with the governor's most recent order, and they're updated with some suggestions and guidelines around Halloween, using what we think are best practices for that. You know, I'm reminded of a story about a lady that trained for a 5K and missed the turn and ended up running either a marathon or a half marathon. It doesn't matter which. And after she was interviewed afterwards, because they found it very odd, it was her first race. And she said something along the lines, you know, that wasn't the race I trained for, it wasn't the race I signed up for, but it's the race I found myself in. And in some ways, this pandemic is like that. It's where we find ourselves, and it changes a bit every day. And we'll keep running the race. You guys want to comment on your surge plans?
I will comment from the Covenant Medical Center side. Let me tell you that we are at about 30% of our staffed beds at Covenant Medical Center that are now dedicated to COVID-19 patients. What that means is we still have some room to flex. But again, as I said earlier, the number of staffed beds is not the only problem. It's the doctors and the nurses that are absolutely exhausted. They have given it their full measure, and they've given it all they've got. It's a question of how many more patients can we put in those beds, how many more units can we convert to negative pressure airflow rooms, how many more doctors and nurses can we call in from their time off to take care of the surge that is occurring. And it's a finite number. There's not a massive army of doctors and nurses out there that we can bring and plug into our healthcare systems. It takes time to get a new nurse or a new doctor oriented, to get them on up to speed, and we don't have that warehouse of nurses and doctors that we can just pull in reserve. So yes, we may have to rely on reserves from the state, but even that takes time. So as the mayor is talking about, as Dr. Cook is talking about, we've got to have some responsibility for this pandemic. We've got to behave better, and we've got to stop this spread, because that is what is the proximate cause of everything we're going through right now.
Dr. Reagan, would you like to add to that?
You bet. So we do have plans. We are in the middle of our surge plan. We're on about stage 4 of 12 stages, but we have deployed additional teams. As Dr. Ryan said, we are using a significant portion of our resources. It varies day by day, but between 25 and 30% of our facility is set aside for COVID. We've moved from 1 ICU to 2, now 3 ICUs that have COVID patients. We've expanded our med-surg capacity to care for COVID patients as well. And we continue to have plans to expand those resources, but there are limits. And we would rather not move down that path further, but step back from that trend of getting more and more COVID in the hospital. And again, the only way for that to happen is for good public health, hand washing face mask and all of that. I think we've made that point clear.
Thank you.
Hi, everyone. Brady King, Fox 34 News. Staying on the topic of hospitals, you mentioned that we're nearing capacity. Is that just for, I guess, the beds dedicated to COVID, or because the city's dashboard consistently shows about 300 to 400 beds available for any kind of treatment? Could you just explain those two?
I don't mind taking that one. So that bed count includes beds that are designated for specific patient populations. So I'll give you a good example, and there are a number of them, but newborn nursery or NICU, neonatal intensive care unit, those beds are reserved for children, neonates, infants. And so you can't put an adult in those beds. So our metric of how full are we is how many patients in the morning are waiting for a bed from the emergency room. So you get admitted from the emergency room, and you're having to wait in the emergency room for a bed to open. And every day we have patients waiting. Today I think we had about 12 patients waiting for a bed. So our usable bed capacity for COVID or non-COVID is very full. There was some mention about patients leaving the region to go to other places, not from our hospitals, but other rural hospitals are trying to send patients to us. We don't have space. They're having to go on to some other place, maybe Dallas, maybe somewhere outside the area. And so we're full. The numbers don't add up because there are beds reserved for specific patient populations, if that makes sense.
Okay, thank you. And then one more question for Ms. Wells. Has there been any outbreaks related to high school football games or church gatherings, or have those been relatively safe environments?
We've seen positive individuals that have been in attendance of those different types of gatherings. With football, it's easy that it's outside, so we don't tend to see as much spread. And again, when they're under the direction of the school, people tend to wear masks. I don't know of a specific church gathering.
Thank you.
Laura Lawhead, KMAC News. With over 60 patients in the ICU, how is our ventilator situation looking right now? And in the hospitals, have you guys seen anyone come and have test positive for COVID-19 and then come back later again with it again?
I'll take that one. One of the things that we have learned about treating COVID-19 is that we don't need to be putting them on ventilators until the very last moment, because they actually do better clinically if they don't get placed on a ventilator. We know that that's essentially a last-ditch effort. So the number of ventilators is really not the issue. It's the number of ICU rooms, the number of doctors and nurses that are taking care of them, the negative pressure that we have to put in those rooms to make sure that we are containing any spread. And those are the things that are crippling the system right now. I did want to add one more thing to the last comment, and that's that we sit and we talk in tunnel vision terms about COVID-19. How many beds do we have? How many doctors? How many nurses? People are still out there having heart attacks, strokes, congestive heart failure, pneumonia from other causes. We're still treating everything we traditionally treat in addition to this COVID-19 crisis. And that's the piece that everybody needs to understand. All medical care didn't stop just to focus on COVID-19. We still have all of those other responsibilities, including car wrecks, assaults, you name it. We still have to take care of that population too. It's a delicate balancing act, but the more resources we have to pull offline to deal with COVID-19, the fewer and fewer resources we have to take care of the routine healthcare problems in our community.
And one last question. As far as Texas Tech goes and their weekly charts, their positivity rates have actually been declining since the beginning of September. Why do you think that is? Do you feel that students are actually heeding your advice and listening?
It's a mix. I think we've had a lot of, early on cases associated with the university, and not even just the university, that age group. And I think it's really just spreading out into other areas of the community.
Thank you.
Hi, Grace Morris with KLBK News. So you talked about the importance of wearing masks. Should businesses in Lubbock be making mask policies when they're stores, and not just a sign on the door, but actually asking people who are not wearing masks to leave the stores?
Well, we certainly have many businesses that are doing that. We think that that is the precaution that should be taken in businesses, as Ms. Wells described a minute ago, restaurants, churches, wherever we go inside to gather. If we'll follow those safety precautions, the protocol, we'll be safe. We'll keep ourselves safe and others safe. And by the way, I think you vote every day with your pocketbook. And if you're going to go out, I hope that you're going to go to someplace that you know is going to try to keep you and other people safe.
And a follow-up question, we're 2 weeks away from Halloween. Mayor Poop, I think you kind of touched on that, but what are some recommendations that you guys have for people who maybe are thinking about going out trick-or-treating?
Well, we would send them to our website for some good ideas about that. We've had a number of our organizations that do trunk or treats that have come up with remarkable safety plans. Our churches, a lot of our businesses that do that. But let's have Halloween. Let's just do it following the same things we've been talking about for the last 30 minutes. There's no silver bullet for Halloween any more so than October 15th today.
Thank you.
Anyone else?
Hello, Julie Castaneda here with KCBD News Channel 11. We've seen an alarming number just this last week of people passing away, people dying. Can you tell us what age group that is, and kind of if they're actually being diagnosed with COVID, or if it's complications from something else because of COVID?
On the age ranges of those who have unfortunately died of COVID this last week, they have been older individuals, 60s, 70s, and 80s. A lot of them are associated with our nursing homes. Every COVID-related death is someone that has been diagnosed with the virus. Sometimes, and I'll let Dr. Cook speak a little bit more to the medical part of that, but they are people that have been diagnosed.
So people don't per se die of a COVID diagnosis. It's respiratory failure, it's kidney failure, it's liver failure, multi-system organ failure, overwhelming sepsis, those sorts of things. But it's precipitated by the initial diagnosis of COVID, and then all the other things happen because of this massive immune response and inflammatory response. So it's certainly, if somebody passes away and they were diagnosed with COVID at that hospitalization, then that will be put on their death certificate.
Okay, that's all I have. Thank you so much.
Anybody else have questions? Okay, no more questions. That ends it for us. Thank you to our interpreters, and thank you to our panelists, Dr. Reagan, Dr. Ryan, and Mr. Taylor. And thank you all for joining us today.